Good evening. We have a couple commissioners missing tonight, and we're socially distancing ourselves, so if you're watching from home, you'll see us quite a far apart. We'll start with the Pledge of Allegiance. I invite you to join us. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Roll call.
Gehrig.
Here.
Grinberg.
Here.
Pepcorn.
Here.
Strand.
Here.
Mahoney.
Here. The COVID-19 situation 2023-23. As you are aware, we are facing an unprecedented situation. We as a nation are facing a viral pandemic. We have witnessed a 500% increase of confirmed infections in the United States the last week. We went from 3 to 32 confirmed cases in North Dakota in less than a week. The city has taken swift and proactive measures to slow the spread of the virus via facility closures, remote work for many of its employees, employee travel suspensions. If this virus continues to infect people exponentially, our goal is to slow the spread, flatten the curve, and protect yourself. However, it's important to learn from our fellow Americans in New York and California. If we do not flatten our curve, our healthcare systems right here in Fargo will not be able to keep up to the level of exponential infections like we're seeing on the coast. It's mathematical certainty. That is why I'm asking all our residents to do the right thing. As your mayor, as a physician, and as a father, I'm asking each of you to physically distance yourself from each other and stay home as much as possible. COVID-19 is a serious threat to the health, not only in the elderly and the vulnerable, but is a real threat to every one of us. Young people are becoming infected as well. I hear the healthy young people who aren't concerned because of their strong immune systems. To them I ask, if you don't distance yourself for your own health, will you distance it for the sake of your grandparents who are in the vulnerable age range? Will you distance yourself for the sake of a friend's mother undergoing chemotherapy with a weakened immune system from a treatment she's undergoing? Will you distance yourself for the sake of a friend with an underlying health condition he or she does not even know they have? Young people truly are likely to survive a coronavirus infection. That is true, but it does not stop them from spreading the infection to those who are not fortunate enough to be able to fight the infection. We need partners in this pandemic fight. Please stay at home. You can make the difference between winning and losing the battle. I need you, the city needs you. Please think twice about taking those unnecessary trips outside your house. Hunker down and help us flatten the curve now. My information from my health department is we do not see people hunkering down as much as they should, and it is a blessing to all of us if we can stay home more and not travel about the city. I like to think about baseball. It's a spring season anyway, but 3 strikes, you're out. You should try to keep your trips minimum. Maybe you got to go to the grocery store, maybe the pharmacy, maybe your liquor store. But if you can try to keep the number of trips you take out of your house every day, that truly will make the difference. Thank you very much. We'll go on with the agenda. Is there a motion to approve the order of agenda, adding an extra item to the end of the regular agenda for COVID-19 and adding an extra agenda, adding that COVID-19 to the beginning of the agenda and adding an extra item at the end of the regular agenda to consider resolution moratorium pertaining to the sale of retail of alcoholic beverages? Do I have a motion?
I so move.
Is there a second?
Second.
All those in favor say aye.
Aye.
All said aye.
Mayor,
Yep.
wasn't there a request from Commissioner Grinberg to pull item 13 off of consent?
You got that as well. We'll bring,
Item 12, I would just, thank you, Commissioner Strand. Item 12 will be on the regular. If
and
that's-
item 12 will be at the end of the regular agenda. Same vote. Roll call vote? Or, I'm sorry, all those in favor say aye.
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 Okay. Is there a motion to approve the minutes from the March 9th, 2020 meeting?
So moved.
Is there a second?
Second.
All those in favor say aye.
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 And then there's a motion to approve the consent items 1 through 24, taking 12 out.
So moved.
Is there a second?
Second.
Roll call vote, please.
Greenberg.
Aye.
Pepcorn.
Aye.
Gary.
Yes.
Strand.
Yes.
Mahoney.
Aye. So we'll go to the regular agenda, and we'll have Desi Fleming speak. Brenton? Commissioner Strand had asked a modified update on the COVID-19 virus today, and on Wednesday there'll be a press conference to update us on the health facilities and what's going on with the health facilities.
Getting that going, and we are starting to see some of those tests trickle in. As in the governor's press conference today, he had noted that we had a test come back from that lab, so we're working on getting those in as they trickle in. They did use the state lab, which is fully capable of handling those tests for high priority specimens, the ones that were in the ICU and the ER, and those who are potentially hospitalized, so we aren't worried on that regard. And then Sanford had just announced today that they are able to do testing internally out of their lab out of Sioux Falls, so we should have about 24 to 48 hours turnaround time for persons seeking care at their medical facility, and that use Sanford as their reference laboratory. So results should be coming in quicker, faster, and able to serve the citizens of the community better. Just a note for those citizens that are listening today, make sure that you call your healthcare provider before just showing up, just because they need to do that screen prior.
Thank you, Brenton.
Good evening,
Desi?
Commissioner and Mayor. Just to add on to that, so for those people in the community that don't have an established healthcare provider, both Sanford and Essentia are offering people to be able to come in, to call first, but even if they're not an established patient, if they meet the criteria, they would be tested for COVID if they would do that. So if you can go through Sanford as My Sanford Nurse, and then Essentia also has a similar, they have a hotline, I think, set up that's on their website, and then you can also do an e-visit, I believe, with Essentia. So those are just a couple things to remember. So
And on that, one of the things we're considered is a lot of times people will call 911 and have an ambulance service come out and bring them in. They can go to these two institutions or independents and get help as well. So they don't necessarily, if they don't have a provider, that's who they should access.
Yep, but again, just calling ahead is the main message that we want. We don't want people with symptoms just showing up at the healthcare system, so be sure to call ahead.
Yes.
So, otherwise, as far as Fargo Cass Public Health, we stood up our health department operations center last Tuesday. So to start out, I just want to give a really big shout out to my staff. They have stepped up fabulously in this event, and working with Brenton has been just really good to have him in our building and to be able to work so closely in this event. Many of the EPR staff have been working on this for months, planning, and people have put a lot of hours in, these last few weeks, and I'm sure this is going to continue. So thank you to all that they do. As you know, this is a North Dakota State Health Department-led event. So we are in their pandemic response plan, so we handle things locally, but they kind of do kind of the directing from above. So we help them as far as contact tracing. We haven't had to do any cases yet because we only have the one case in Cass County. But nurses are trained to assist Brenton if need be, if he would get overwhelmed, so they will step into that role. We also have been putting a lot of content into the Everbridge system, which is our new mass notification system in the city, and so we are assisting long-term care with getting lists in. We're assisting other health departments around the state, helping some of those regions. We're assisting people accessing medical cash, like the state has some medical supplies that healthcare and first responder people can access. So if people need help getting into HON assets, then we kind of give them direction on that. We also have been in our healthcare group and community partners, assisting them, giving them guidance. We've been doing fit testing and PPE for those first responders and healthcare groups that haven't had that done. As we've talked before, the N95 masks need to be fit tested before they can be properly and effectively used. We also have a huge communications team that we've been adding on to, it seems like every day, for monitoring situational awareness, monitoring messaging, what resources do we need, all the gaps out there. So we're kind of monitoring that, seeing how we need to respond, taking things from the CDC and North Dakota Health Department and adapting them for our areas. So those are also big areas for us. We have some interns from the Emergency Preparedness Program at NDSU that are working with us that have also been fabulous to help with some information gathering. And among all this, we also are still having to provide some essential services through our health department. So we have the shelter that we're having to staff. We have the Cass County jail nurses who are providing services. We have some home care clients that we have to see. We have some essential services in the clinic. So all of that is going on, as well as directing this. So it's coming together very well. So our main message in public health, of course, is kind of what the mayor said in the beginning, is everybody has a role to play in this. So the more that we can do those everyday prevention things, good hygiene, good prevention practices, practice that social distancing, stay home if you don't need to be out. I mean, there are essential services, people that need to be out, but for the majority of us, we need to stay home. We need to stop the spread, slow it down, flatten that curve so that we can stretch it out so our healthcare partners don't get overwhelmed. So thanks to everyone in the community for your efforts so far. It's going to take all of us to do our part. Any
Commissioners,
questions?
any questions?
Mr. Chairman, I would thank Brenton and Desi. I think it's just a few remarks. Oftentimes the public doesn't understand, or have opportunity rather, to see and hear the planning that goes on, like the flood events in the past. And I think it's important to recognize the preparedness and the professionalism that was displayed throughout this last couple of weeks that I experienced. I had the opportunity to sit with you, Mayor, with department head meetings on the morning of the 13th, after numerous conversations about CDC guidelines and what we were doing as a community to prepare. And it was obvious to me at that meeting, under the leadership of Bruce Grubb, that we have a consummate group of professionals that are well engaged and working very hard, and the city of Fargo should be proud of your efforts, because it's real and it's tangible. And I just want to say, my appreciation for the hard work that you're doing and the hours that it's taking to move this forward. And likewise, Mayor, your leadership with working with other cities in the county and the governor's office, I just think it's important to recognize that communication is key in these events, and everybody is working hard. And so I'd just like to say thank you to you for keeping a hand on the rudder and sending the message of being calm, but being strategic and methodical in our approach as we prepare for this. And likewise, I'd like to thank the governor. For those that have watched Governor Burgum over the last week with his 4 o'clock press conferences, he's doing an amazing job leading our state and interfacing with local communities. So those would be my observations at this. And as we know, we're not through this yet, but I think we're well poised to prepare and deal with this as best we can, and I thank you.
Thank you. Mr. Strand, did you have anything?
Thank you, Mayor Mahoney. I'd just like to join in with what Commissioner Grinberg said. We as a community should be really proud of our staff, our public health people, our emergency response folks, everybody who's in the trenches that's rolled up their sleeves and is doing an extraordinary job protecting us and educating us and informing us. Desi, would you please tell your people that we know they're working long, hard hours, and it's appreciated by everybody in the region, not only the city, but the whole entire region, all of our family and all of our friends that are worried about our health. Thank your staff and your people for making sure that we're taken as care of as possible. Mayor Mahoney, let's just keep aiming the right direction. We, as a city, have had some preparation practice with floods in the past. This is a different sort of an event. It's epic, and it's historic. and it's something that we need a constant balance between preparation and over preparation and making sure we're not underprepared. So thank you for your leadership, and thanks to everybody for staying on course. We've got several weeks ahead of us, hopefully quicker than not, but we have great people and great leadership and great resources, and we're blessed. So thank you, Mayor.
Thank you. Any other questions of Desi? She has to get off and do some more reporting tonight and some more work, so we're going to let her get off the podium and get back to work. Thank you very much.
Thank you.
We'll go to the State Water Commission, item 25. There's a request for reimbursement of $114,099.62. Do I have a motion?
I'll make the motion.
Second?
Moved and seconded. Any discussion? Roll call vote, please.
Pepcorn,
Aye.
Grinberg,
Aye.
Gehrig,
Yes.
Strand,
Yes.
Mahoney.
Aye. Public hearing, item 26A, it's going to be a continuance of the Prairie Grove 5th edition. It will continue the hearing to Monday, April 6th. Do I have a motion?
I'll make the motion to continue both 26A and B.
Second?
Second. So continuation, another one is the Community Development Block Grant, CBG Investment Partnership Program. So you move both of those. Was there a second, did I hear?
Yes, second.
Moved and seconded. Any discussion? Roll call vote.
Pepcorn,
Aye.
Grinberg,
Aye.
Strand,
Yes.
Gehrig,
Yes.
Mahoney.
Aye. Item 27, applications for property tax exemption for improvements made on buildings. Do I have a motion?
I so move.
Second?
Moved and seconded. Any discussion? Roll call vote, please.
Pepcorn,
Aye.
Grinberg,
Aye.
Strand,
Yes.
Gehrig,
Yes.
Mahoney.
Aye. So we go down to item, extra item, it's a moratorium on the sale of, retail sale of alcoholic beverages. Explanation by Tony Grinberg.
Mr. Chairman, first let me start off by answering the question, how did we get here? As we know, last week, which I understand was a combination of a number of mayors across the state requesting the governor make the declaration of closing bars and restaurants, which he did. And that evening, I received a call from former Representative Betty Grandy. And she said, you know, with the food service and takeout and delivery, Texas just passed a temporary moratorium on allowing alcoholic beverages to be delivered with a meal. And so I took that, thought about it over the night, and then Friday morning had a phone conversation with Eric Johnson about what options we have as a city to allow that to happen if the decision was to provide that here at the city. And so Eric worked on a resolution which is before you that allows that to happen, and in essence empowers the mayor to make that declaration upon approval tonight for a moratorium of the ordinances to allow that to happen. A little bit of additional background. Over the weekend then I spoke with the head of the North Dakota Hospitality Association and learned that this is an area that they've been talking about since the governor's declaration that would be of help to the hospitality bars and restaurants across the state. In particular, I understand that the city of Minot on Friday night approved such a change to allow that on a temporary basis. We've also talked with some other restaurateurs in town that, you know, admittedly say this isn't going to, you know, solve everything, but it is going to make a blend of a business opportunity to keep in business. And what really struck a chord with me is not the chains or the franchises, but the independent bars and restaurants that are probably a little more challenged by this. And so through a combination of discussions, felt it was important from a small business perspective and convenience with encouraging people to stay home. If they'd like to order a hamburger and have a couple beers delivered with that, that would be a convenience. And so that's what brought us here. And I know Mr. Sprague has maybe a few comments on the resolution, and I'll yield to him.
Chief Sprague.
Well, thank you, Commissioner, for bringing this forward. I have received a number of phone calls from bars and restaurants wondering what can they do that's a little bit out of their, you know, normal procedure. And I think this fits right in that path that they'll be able to now offer some extended services. And you know, I know on the conference call we had earlier today, we had the chief on, and from his office and from our office at the auditors
I just see this as a win-win for everybody, a way to allow them to enhance their sales, and you know, hopefully they'll be able to increase a little bit of sales too, so.
Nancy Morris, you want to go from the legal part? This will be for a short while, or?
It is set up for a 30-day, and the time that it expires is a day of a city commission meeting, so it will be available for consideration at that time, 30 days from now. The change is just a change to the definition of on sales. So that would be allowing them, the definition of on sales is on the licensed premises. So that would be the change for takeout, curbside, or delivery. But of course, all other applicable laws would apply. Those that deliver the alcohol would be of appropriate age, no open containers, and so forth.
But I could go pick it up as well, right? If I came to the restaurant, I could pick it up and they're out in the parking lot and they could give me 2 beers with my pizza?
That's correct. Proper age verification and not an open container. It'll be a sealed container.
Very good. Do I have a motion?
I move for approval.
Is there a second?
Second.
Any discussion? Mr. Gary, or Grinberg, I'm sorry, Gary, you okay with this?
Yep, sounds good.
Okay, roll call vote.
Grinberg,
Aye.
Pepcorn.
Aye.
Strand,
Yes.
Gary,
Yes.
Mahoney,
Aye. And item 12, right away, your agreement with PSJ Acquisition LLC, Prairie St. John's, and Alpha Construction. Brenda Daring to explain. I think Commissioner Grinberg pulled this one.
Yes, Mr. Chairman, members of the commission, received a call mid-afternoon with a concerned resident and felt we should have a discussion. And since then, I've learned Brenda has resolved the issue, so I'll turn it over to her.
Well, good.
Good evening, Commissioners, Mayor. Yes, this afternoon we did receive a concern from one of the local neighbors, and we've been talking. I did reach out and visit with her a little bit about exactly what her concerns were. I walked her through the packet, explained all the items, and then we also have been communicating with Prairie St. John's CEO and visiting with him. It just seems to be a little miscommunication between the two entities. In talking with Ms. Fremstead, we talked about a couple of changes we could make to the agreement, which were pretty minor. One is that to allow parking on the east side of 3rd Street, which is allowed today. We are making it a one-way, which it was always our intention to maintain that, but you would just like that as part of the approval. And then also Exhibit D and E, they have a road closed ahead sign, and she felt it's just, it would be nice to have road closed to through traffic, just so people understand they can't make that loop. So very 2 small changes that would take care of her concerns.
Very good. So you have a motion accordingly?
So moved.
I'll second it.
Any discussion? Roll call vote, please.
Grinberg,
Aye.
Pepcorn.
Aye.
Strand,
Yes.
Gehrig,
Yes.
Mahoney.
Aye. Is there a motion to adjourn?
I so move.
Second.
All those in favor say aye.
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 Aye. Aye.
We're adjourned. We hope to see you guys next time. Thank you.